Hello everyone. Divine Yoga for Women, Beautiful Women series. Today's guest is going to be Parijat Deshpande, who is a high risk pregnancy expert. Let's wait for her. Hi Malashri. Yes, I think she will be joining in few minutes. Okay, Parijat. So she has been dealing with high risk pregnancies and complicated pregnancies, infertility, etc. And Divine Yoga for Women is very happy to invite her. I think she is ready. Let's hear her thoughts, knowledge. Hi,
Hello.
how are you?
I'm good. How are you?
I'm good. It's very early here in India.
Thank you so much. You must be so tired.
No, I was actually energetic to. I was looking forward to talk to you. So it's mutual.
Wonderful. I'm so thrilled to be here. Thank you for reaching out.
Thank you, Parijat, for accepting our invite and being on our live. Thank you so much for that. Uh,
Yeah, it's my pleasure.
okay, so tell us about yourself. So, how did you get here? Because the name itself, high risk pregnancy expert, it's actually a tough job. It's actually an emergency job. It's not like a normal job. I was like, I'm curious to know more about this. How did you get here, and what pregnancy made you to come here?
Yeah, absolutely. So I am here because of personal experience. This was not my original career.
Okay.
I was trained in clinical psychology. I was working as a child and family therapist. I was teaching psychology at a local university at the college for college students, and I was just kind of doing my thing. And it was my personal experience with infertility, a life-threatening loss, a very high-risk pregnancy, months on bed rest, and then my son being born extremely preterm.
Oh,
That is what inspired this work because I realized that there is the standard medical care that's provided to women who have high risk pregnancies, which is what I received. And there is an aspect to that care that is not included in medical care that is just as important to help women stay pregnant, even if they have complications.
yes.
And that dives into the health of the nervous system, which is not a part of standard prenatal care. And so when I realized that I was able to control my preterm contractions on hospital bed rest when my medical team had told us I'd
Oh.
only have 72 hours and we could see changes on the monitor. Nurses could see it, the doctors could see it. In addition to, of course, I said yes to all the medical treatment. I said, give me all the medications you've got. I want to help. I want to stay pregnant. But at that point, I was hospitalized at 22 weeks and 4 days.
Okay.
And at that point, it's just too early for most babies to survive. And so
Yeah.
my medical team was preparing me to lose my son. And I
Mm-hmm.
said, give me all of the treatments you have. I will say yes to all of it. And also, I know that there is another aspect to my body that we are not addressing at all, which is the nervous system. And so let me do that myself and let's see
Okay.
what happens. And they gave me 72 hours and we ended up with 15 days. And that was the difference between losing my son and giving him a chance at life. And I realized if
Yeah.
I can do that, anybody can do that. And that was what inspired the work that I'm doing now.
That's really awesome and inspiring, Parijat. So, many of us, we are not aware, like, what factors that cause high risk pregnancy? Like, can you tell us about your factors?
Yeah. So
Yeah.
I'm so glad you asked this because high risk pregnancy is a really broad term.
Yeah. Yeah.
It can mean a whole variety of things. It could mean, so the United States, you are considered to have a high risk pregnancy if you're over the age of 35. Just by age
Okay.
alone, no other risk
No.
factors.
Okay.
But you can also be considered high risk if you are carrying twins or higher order multiples,
Right.
triplets, quadruplets, things like that. If you have a history of certain illnesses, for example, a history of asthma, a history of cancer, history of chronic illnesses of different kinds, you can be considered high risk. If
Okay.
you have a history of pregnancy complications or preterm delivery, then you are automatically considered high risk in your next pregnancy. Also, you may start off as a low risk pregnancy. Everything's completely fine. You don't check any of the boxes for high risk pregnancies, and then you
Okay.
develop a pregnancy complication, and then suddenly your pregnancy is labeled high risk, which I realize can
Yeah.
sound really scary for a lot of people. And so, when we hear the term high risk, I really want people to understand that it doesn't mean that there's a very particular outcome that's going to happen. It just means that you are going to have extra eyes on you. You might need some additional treatments or some additional monitoring. You might have to add some people to your team, like a high risk pregnancy medical doctor, or somebody like me. Also, in addition to that, you don't want to add me without the doctor, certainly, but
Yeah.
you might have to have some specialists on your team that are going to help you specifically. And it is very possible to have what is labeled a high risk pregnancy and go on to deliver a full term healthy baby. It's absolutely possible. It does not mean you are definitely going to deliver preterm or that there's something horrible that's not definitely going to happen, which I know that that label can sometimes imply.
Yes, this awareness is actually required. So that's what people like you are doing. So for many of us, we don't know how to differentiate between stress and a trauma. So can you explain about it?
Yep. So here's another umbrella. So this umbrella is called stress, and there are a variety of different types of stresses. The two that I see most frequently is chronic stress and traumatic
Okay,
stress.
traumatic. Okay.
And so it falls under that same umbrella. And essentially what we mean by traumatic stress is a nervous system that is frozen in survival mode. And so I
Okay.
like to give the example of being chased by a bear. If you imagine you're out and you're having a wonderful time, and then you suddenly hear some leaves rustling, you go, what was that? Right? And
Okay.
then
Sudden arrest kind of thing. Yeah.
yeah, and then if you see the bear kind of coming out and poking its head out, what happens in our bodies? Our entire body goes into survival mode to keep us alive. And usually what most of us will do is we will run. And our
Yeah.
bodies will support a level and a pace of running that we may not be able to do just when we're out jogging on a typical day. It is specifically to keep us alive. That is a stress response. There's nothing wrong with that stress response, because
Okay.
typically what happens is we have that surge, we have that momentum of, oh my gosh, I gotta go, and I'm running, and then we can sustain that. A human body can sustain that even during pregnancy for a short amount of time without any complications happening to our health.
Okay. Okay.
The problem becomes when we stay there and we can't come back down from it, right? And so let's go with that example for a second. So you're running away from the bear and you're in the woods and you're running. What happens? At that point, you have to stop and find a cave to catch your breath, right? So you find a small little place, you can duck into it, and you're hiding, and you catch your breath, and you're looking around. Okay, is the bear okay? Okay, is it gone? Okay. And then I pick up and I keep running to my car. And I run until I get to my car. I'm in the car, and then I'm driving as fast as I can to get away from the bear. And in that process, what happens is I start coming down, right? And that's when I start to notice how hot I am, how much I'm sweating. Oh, my mouth is really dry. Taking off my jacket. I like just now starting to think about having actual thoughts happen in my head of what happened? What was that? Right? It's a very predictable pattern that our body goes through, which is the stress response, which is kind of like a curve like
Curve.
this.
Yeah.
Everything's fine. Here's the bear. And now I'm coming back down to everything's fine. Chronic stress is when we keep kind of going back here over and over and over and over and
Okay.
over.
Okay.
Traumatic stress is when we are frozen at the top and we cannot experience that come down. And so the work that we do for chronic stress versus for traumatic stress is very different.
Okay, okay. So trauma and stress are two different extremes, right? It's like an arrest kind of thing, trauma. Yeah.
Yeah,
Okay.
it really is. You can really just imagine like a rubber band that if you put in the sun, right? Typically a rubber band you just stretch really, it's very elastic. But if you put it in the sun, it loses its elasticity. And that's what happens to our nervous system when we are living with traumatic stress, is it loses its elasticity. And so that is the work that we have to do. It's not about calming down. It's not about feeling happier. It is about restoring that elasticity back into the system and
Mm,
into the
mm,
body.
mm,
And that's important in pregnancy because the nervous system is the only body system that touches every other body system. And for
mm.
pregnancy specifically, we focus on three: the nervous system, the immune system, and the endocrine system, which is for
Endocrine.
hormones.
Okay. Mm.
And those three have to be in a very particular balance to have a healthy pregnancy. And if the nervous system is off, it will shift the other two and put you at risk for pregnancy complications. And that's where my work comes in.
That's really awesome, Parijat. So, how do we prepare for this high risk pregnancy? Like a pregnant woman, how can she prepare her mind?
Yeah.
Yeah.
It's a couple of different things. One, you want to make sure you have the right people on your team. And so
Um,
even before you're pregnant, if you know you're going to be high risk for any number of factors that we had talked about earlier, if you know, okay, I delivered preterm before, I have a history of cancer or heart disease or something, I know I'm going to be high risk, then one, you want to make sure you have the right medical support on your team. So I often
mm,
suggest doing a preconception appointment with a perinatologist, which is a maternal
mm,
fetal medicine specialist who
mm, mm.
specializes in, they're basically an obstetrician specializing in high risk
Okay.
pregnancies.
Okay.
So make an appointment with them before you are pregnant. Review your history. What makes you high risk? What are the red flags that they're going to look for? What are some
Mm-hmm.
precautions that you can take from a medical perspective? And what is their
Okay.
plan medically
Mm.
to help prevent complications in your pregnancy, or at least reduce your risk if your risk is very high? So that's one piece of it. And you
Okay.
want to make sure that that's set up before you're even pregnant. You don't want to start building that team once you are pregnant. Now, again, if becoming high risk is something that you weren't planning on and then it happened in the middle of pregnancy, that's okay. You can still build that team at that point. But if you know ahead of time, do it early. And then the second piece of it is look at your nervous system. Look at your nervous system health. It shows up in a lot of different ways: chronic health
Mm-hmm.
issues, chronic pain, insomnia, anxiety, what looks
Yeah.
like depression. There's so many
There are a
different
lot
ways
of
that it looks at.
factors.
Yeah.
Mm.
And if you have any of those, build those people onto your team. Somebody like me, if you have somebody in your area, if you're whatever that might be, or me specifically, bring them into your team and make sure you are addressing both, because you need both in order to really have the best chance at a healthy pregnancy.
Okay. Okay. So, Parijat, there is a thing called infertility and miscarriage. Okay. So,
Mm-hmm.
can stress causes recurring miscarriage? Is it associated with pregnancy stress?
So I will say it does not cause it,
Okay.
because human biology is too complicated for us to say that the stress response or the traumatic stress that we are living with can have a direct cause to any of
Okay.
these complex health
Mm.
issues. But we do know that it does play a role, and it plays a role through that example I gave of the three
Three. Yeah.
systems. When
Endocrine. Mm.
the
Yeah.
endocrine system, the immune system, and the nervous system, when the
Yeah.
nervous system shifts because of that stress response, which is what it's supposed to do. So it's not that anything's
Okay.
wrong. It is you want your nervous system to change. When you're running from the bear, your whole body needs to function differently than if you're sitting at your
Yeah.
desk having a conversation. It cannot be the same. Otherwise, that's not good for the bear, for you in the bear situation. Um, but what we do know is that because of that shift in the nervous system, due to that stress response, which could be due to chronic stress, could be due to
Mm-hmm.
traumatic stress, um, there's an increased inflammation due to the shift in the immune system. And there's a shift in hormones as well, which
Hormones.
can
Okay.
impact your ability to get pregnant and stay pregnant. It is not the only answer. It is not a causal factor. But if you
Okay.
imagine kind of women's health as a puzzle, it is a part of the puzzle. So we can't
Okay.
ignore it, but we also can't say it is the only thing.
Yeah, okay. There is a myth, right? Stress and miscarriage. Okay. So, can a recurrent miscarriage, can that woman carry a baby again after recurrent miscarriage?
Yeah, I'm so glad that you asked that. Recurrent pregnancy loss is so devastating.
Yeah.
And part of the process for that is diving deep into figuring out what is going on.
Okay.
One of the things that I like to remind people is if you don't have an answer yet, that doesn't
Okay.
mean there isn't an answer. That means we have to
Uh,
keep looking.
yeah.
And that can be a really difficult part of that process. But yeah, it is absolutely possible once you find kind of what that root is or multiple
Okay.
roots that are contributing to the recurrent pregnancy loss. Once you are able to address that, if it's possible to address, then yeah, then women can go on and carry a healthy pregnancy. And
That's a nice
yeah,
information. Yeah,
yeah,
many people they are suffering uh, by this miscarriage and pregnancy loss. It will be
yeah,
very useful for them, but they
yeah.
should keep trying, right? Yeah. So
I would say if you're experiencing recurrent pregnancy loss, I actually have a really wonderful podcast episode that I did with a recurrent pregnancy loss specialist on my
okay, okay,
podcast called Delivering Miracles. I
okay,
think it's podcast number 54, I believe. It,
okay.
it says recurrent pregnancy loss on it. I can send you the link after.
Sure.
You don't want to just
It
keep
will be
doing the
very
same thing
yeah.
over and over and hope for the best. That is not what you want to do. If
Okay,
you
we
have
need to
experienced
explore different things. Yeah,
exactly. What
yeah.
happened? What else can we find out? What is my body telling me that needs to be addressed? And that could be addressed medically, it can be addressed through your nervous system, or it can be both. What is it? And there's no way to
Okay,
know just from the outside. You have to do some exploration. That's
yeah.
why it's so important to have the right people on your team to help you do that.
Okay. Parijat, there is a myth in India like age is also a factor of for pregnancy, miscarriage, and all. So, how do you see this? Age.
Yeah,
Yeah.
it age is a risk factor. It is.
Okay. Okay.
If you are using your own eggs, especially,
Okay.
then yes, it can be an added risk factor. And so here in the United
Okay.
States, certainly women are watched more closely when they are over the age of 35, and certainly over the age of 40 to
Mm-hmm.
just watched far more closely, especially in that first trimester when most of the miscarriages happen, but certainly also throughout the rest of the pregnancy.
Okay. 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 So, Parijat, there is some hormone related things with pregnancy. Many people or many women they suffer from thyroid hormones. Okay,
Mm-hmm.
can thyroid lead to infertility, or
Mm-hmm.
can it
Yep.
be
Yep.
the reason for infertility?
It can be. It can be. And again, it's not just a one-to-one kind of
One.
thing. That's
Okay.
often what it looks like on paper. We also want to look at what caused the thyroid imbalance, right? And
Oh,
so
okay.
if we really want to get to the root of it, oftentimes what happens is doctors will run a thyroid panel. Oftentimes, at least in the United States, it's an incomplete thyroid panel, so we don't even get the full picture. But even with a complete thyroid panel, we we see that okay, the thyroid is maybe off balance, either hypo or hyper, and they'll
Okay.
address that. And then
Hmm.
there's likely a good chance that you'll get pregnant and have a healthy pregnancy as long as that is managed properly. But it doesn't quite address the root of it, is what caused that
Okay.
imbalance to begin with. And that's
Okay.
really important, not just for getting pregnant and staying pregnant, but also overall your whole health will continue once baby is born. And
Okay.
so how can we keep you as healthy as possible? But again, with that example of the puzzle, this is absolutely one piece of it is thyroid health, definitely.
Okay, okay, okay. So, Parijat, is this people they have their first pregnancy as a C-section and they really want their second pregnancy to be a VBAC?
Hmm.
So, is it possible after 2 years to get a VBAC after C-section?
It is far more possible than we are often
Okay.
told. That
Yeah,
doesn't mean it's
there is a
possible for
myth. Yeah.
everyone, but exactly, we are often discouraged from that quite quickly. And I think that is, my opinion is that it is a blanket statement that I guess the theme of today is exploring, because I was going to say we want to really
Hmm.
explore what is your specific risk factor. Do you have any? What are they? How serious are they? And can you still choose a VBAC if
Okay.
you want? And for a lot of women, that choice actually is on the table, but they're often made to feel like it's not. So it's absolutely worth a conversation with your team. And if you don't like what they're saying, get a second opinion, get a third opinion to really understand what your options actually are given your history and your health.
Okay, okay. So many women, they are suffering from GDM during their pregnancy. Um, is this considered as a high risk, Parijat? I just wanted to know.
It it is technically yes, because it is a pregnancy complication. Oftentimes, women who are diagnosed with gestational diabetes
Just, yeah.
can just be monitored with their OBGYN, and that's often enough.
Oh,
They're not necessarily recommended to see a perinatologist. If you want to, for peace of mind, you can absolutely ask for that. But yeah, I mean, technically on paper, it would be considered a high risk pregnancy. And also, as I started this whole thing with, it doesn't necessarily mean anything for sure is going to happen to your baby. There's a lot of opportunities you have to influence your health and baby's health to still
okay.
have a really positive outcome.
Okay, that's really nice, Parijat. I just wanted to know about the placenta. So low-lying placenta. Okay. Can this be a factor for high risk?
Yes. Yeah, that one
Oh,
is
okay.
certainly a factor that you'll be watched very closely for.
Yeah,
And
yeah.
there are some women, depending on exactly where it's positioned, will find themselves bleeding throughout the pregnancy or parts of the
Okay.
pregnancy, and that
Yeah.
can be very scary. You may have different choices as it comes to delivery options. So these are all things that you want to continually be talking to your team about. What are your options? What are your choices? What are choices that are no longer available to you? Because
Okay.
that might change. Some women, depending on the physician,
Mm,
might be prescribed bed rest at home or modified activity restrictions at home. Some might be sent to and admitted to the hospital for the duration of the pregnancy.
mm.
And yeah, this is one that you want to watch, and you will be watched quite closely about.
Okay, okay. So there is again a myth related to physical exercise and pregnancy. Can a pregnant woman do exercise, walking, yoga, and all? Since this is an yoga page, I just wanted to
Right.
hear it from you.
Yes, 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 yes. Unless you have a complication that prevents you from doing exercise, which can happen. I several of them. So that can
Okay.
happen. But unless you have that, exercise is actually one of the things that can help you reduce your risk of many of these complications.
Yeah.
So yes, moderate exercise, as long as you are medically clear to do it, is so good for you. It's so good for baby. It's so good for preparing your body as you carry on through the pregnancy and prepare for labor and delivery, and actually can make the postpartum
Mm,
recovery process better. So
mm.
yes, if you can exercise, please do it. It's so good for you.
Yeah, thank you. Again, have you tried yoga, physical exercises, meditation, and all?
Mm-hmm.
Do
I
you like
have.
it?
I do. I find the restorative yoga the most appealing right now. But I'd
Yeah.
say maybe pre-COVID, I was preferring the more active
Okay,
versions,
okay.
different forms of yoga. But now I'll do the restorative all
It
day long.
it gives a lot of peace. Yeah,
It does.
yeah.
It does.
Restorative yoga. Even I like. It's like for. It gives better sleep also. No, the undisturbed sleep. It's very amazing. Yeah.
It's incredible. Yes.
Uh, Parijat, your name itself is very beautiful because
Thank
it's a flower
you.
name.
It is.
Yeah,
Yes.
yeah, I like that.
And thank you. And can I say how nice it is to hear somebody say it properly?
It's
I
very nice.
appreciate it.
In Tamil, they say Parijadam. It's very pleasing and it's a nice name.
Thank
When
you
I
so
told my husband, he
much.
was asking, "Is it an old woman?" Like that. The name is too old, ancient, and it's very beautiful. Yeah.
Thank you
So.
very much.
Okay. Parijat, you are an author. I just saw your book, like Pregnancy Brain, about your book, Pregnancy Brain. So many pregnant women, they can read your book, which will be available. Where can we get that book, Parijat? Is it available
Yeah,
in Amazon?
it is. Yep, it's available on
Okay.
Amazon, on Kindle, as well as paperback. And
That's
so
great.
either option is available to you.
Okay, everybody must read because you will know the factors related to high risk that to written from an expert like you.
Thank you.
Thank you so much, Parijat. So there are many questions. Only one or two we will read. Okay. So mine
Sure.
was extremely preterm and got delivered my babies at 27 weeks after
Mhm.
NICU. They came to my hands. Now they are healthy only because of positive mindset and mental health. Yeah, this you should
It's a
talk
great
about it.
story.
How to how this mental health and pregnancy they are uh, go hand in hand with.
Yeah. Yep, they do. And truthfully, many of the mental health conditions that we talk about in pregnancy, specifically you hear about anxiety and depression the most,
Yeah,
all tie to a nervous system that is not functioning the way that it should. Most of the time, not all the time, but most of the time, that's what we're finding. And so it is important that you get the support that you need to not only feel happier and feel more at peace, but also really addressing what's going on inside the body that is at the root of these experiences to help you have a healthy pregnancy. It is an absolutely essential part of
it
prenatal care,
is.
I do believe.
Okay, okay. Parijat, there is another comment like I actually joined to feed my babies. I was also in high risk pregnancy with cervical length 1 centimeter with twins. Okay, with
Mm-hmm.
contractions at 20th week. But luckily, I was into bed rest till 27 weeks. Okay, okay,
Great, 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 great. Yeah,
okay. So there are a lot of things to know about this high risk
yeah.
pregnancy. So how do we reach you? Do you take any sessions or how to book an appointment with you, Parijat?
Yeah, so all of that information is on my website
Okay,
at my full name, parijatdeshpande.com.
okay,
And there are two ways to work with me. One is I work with women through their pregnancy to support their bodies from
okay.
when we start working till 4 weeks after baby comes home.
Oh,
And
that's great.
that is the pregnancy support I provide, which includes, it's all deeply body based, nervous system health related, as well as helping you learn how to navigate your medical system to
Okay,
get the prenatal care from the medical providers that you need so you avoid medical errors and things like that. And then for women who are done growing their family and realizing they've actually experienced a tremendous amount of
hmm.
trauma on their family building journey, whether it was fertility trauma, pregnancy trauma, or birth trauma, or NICU trauma is one that comes up a lot. I have a group program for that,
Oh,
for the healing aspect of it. Once you are done growing your family and you are ready to heal and get back to feeling that sense of peace in your life. So those
that's
are the two
really
ways to work
nice.
with me.
Yeah.
All those details are on my website as well as the
Okay,
link to Pregnancy Brain, my book.
okay. Everybody can check Parijat Deshpande's page and you can get benefited. She has a lot of information. She has a lot of sessions and you can go through her book also. So thank you for being with us, Parijat, because this beautiful women series really brings the talent, the power, the efforts of beautiful women like you, who is beautiful in and out.
Thank you so much. And what an amazing campaign that you are doing, just highlighting the work that so many women, even like yourself, are doing in the world to just make it a better place for everybody. So thank you
Thank
so
you.
much.
Thank you so much. Thank you so much for being with us. And I really enjoyed doing this session because it was so much informative.
I'm glad.
My previous lives would be like a casual talk. It will be like this is like a friendly talk, but it was more informative. I really liked and enjoyed the
Oh,
session.
great.
It will be very useful for pregnancy women and who are trying for babies. It will be very useful. Your positive words, your positivity is really it's really amazing.
Thank you so much. I so appreciate it. Thank you for having me.
Thank you so much. Bye bye.
Thanks. Bye.
Bye.